何かコメントあるいは質問がある方いらっしゃいます。どうぞ。
My name is Dr. Honda from NGO Share, and I'd like to pose a question to Mr. Morrison, and I respect you very much from your talk of humility-based conversation or intervention. I know that even the 2010's Obama medical reform or health reform was really criticized because it has a tinge of socialized medicine tendency or something like this. And I don't understand why American people hate the kind of stigmatized word socialism. And the heated debate is going on in Japan, because I talk this because we are very much in a heated debate about whether Japan should join the TPP, Trans-Pacific Trade Partnership. And Mr. Obayashi's Nikkei Shimbun is strongly supportive to this TPP. But some of my best doctors that I respect who are working in the rural area are adamantly against this. And it's a very, very tragic situation, and I don't see how we can solve this problem, and I'd like to have your comment about whether Japan should be advisable to join in the TPP partnership.
モリソンさんいかがですか。
Well, you raise the issue around Americans' apparent antipathy to socialism. Well, I'm not sure that it's. I mean, some critics have used that line against it. The people that are coming on to the people who will benefit, that are underserved in America, who will benefit by the new legislation, tend to be the poor and the underserved and the more marginal populations, and the costs will be borne by other parts of our society. And in that sense, there's a social value and a social commitment to that. There's also huge inefficiencies in the system that we have, and you can make the case that this is much more cost-effective and rationalized than what we have today, which is a terribly expensive system with very poor outcomes on multiple levels. So there's a bigger debate that's gone on back and forth, and I don't think it really comes down to whether we're socialist or not. I think it has to do with whether we believe that there should be equity and cost effectiveness combined in the delivery of health to Americans, and how do we do that? And it is remarkable, in my view, that the Obama presidency staked so much on achieving this, and of course one passage entirely on the basis of Democratic votes, and that this is now in peril, and will be, and we will see what happens. It's a historic moment and a very polarized moment there. As to TPP, I'm no expert on all of these issues. I tend to be pro-trade. I tend to believe in the value of trying to renew economic growth, and this notion of a broad multi-country negotiation seems like something that will be require terribly high political investment in order to move this forward. But is it going to be controversial and pose a threat to existing interests in many of the societies, including rural doctors, or folks that are worried about what happens in the exposure to global markets on production of medicines and agricultural products? And of course, this is something that we in the United States struggle with in terms of trade, liberalizing trade, and dealing with our own constituencies who become marginalized or exposed or vulnerable to those changes, and how do you make those become managed transitions where growth is stimulated, but those that are the losers on the losing end of some of these, that somehow there's a strategy of mitigating those stresses. And I can't say how this will be managed in the Japanese context, but I'm sure there are solutions for this. Thank you.
TPP についてコメントもしありますか。TPP と医療ということで。
はい、ありがとうございます。医療日本のヘルスケアそのものがTPP の交渉に参加することによってアメリカ式に塗り替えられていってしまうという議論を日本ではたくさん聞きますけれども、今日も実は今予算委員会を衆議院でやっておりまして、総理がそのことについてコメントされていましたが、TPP の中で日本の健康保険システムについて手を突っ込むということはしないというふうなことも触れていました。その辺はある意味アグリーメントというか合意が取れているところなんだと思います。ただしやはり薬だとかそれから医療機器だとかまだまだいろいろな分野が実は残っておりますので、その皆保険制度そのものがなくなるということではないにしても大きな影響を受けるのは確かですし、また逆に日本がそのことによってTPP によってものすごい大きな利益を得ることも確かです。でここのところをどういうふうに選択するのかということで、これこそ本当にですね医療関係の中でもかなり割れる問題なのではないかと思いますし、それから病院勤務の方たちとそれから開業医の先生方ではやっぱりまた相当意見が割れているということも聞いております。そういった意味ではこれは交渉事ですので、全部こうですって言ってから交渉に行くことはありえませんから、ものすごく大きなナショナルレベルでの議論になろうかと思います。でその時にどういうグループがどういうそのインタレストグループがどれぐらいの声を発するのかということで、私がおります政治側っていうのはものすごく大きな影響を受けます。ほとんどそれでですね議員たちはほとんどひるみますので、それで物事が思わず、近視眼的な選択をすることもあり得ると思うんです。で先ほどどうしてアメリカで皆保険制度を入れようとするとあんなに大反対が起こるのかというコメントございました。2010年の改革もそうでしたし、それから1994年の時も失敗した時の改革もそうでしたけれども、本当にですね短期と長期の問題が大きいと思います。日本でも短期を見るがあまり長期のベネフィットを見失うということがありますが、アメリカでも長期的には保険のコストが大きくなるので、短期ではかなり税金で支払ったりいろんなことをしなきゃいけないけれども、長期にはもっと良くなるということをいろいろ説明しようとするんですけれども、短期に今保険を持っていない人たちのものを保険を支払っている私たちがまた全部被るのだという議論にどうしても負けてしまうところがあります。でここの穴埋めというのがなかなかできなくて、また業界のロビーも大変強いものですから、私の元上司が今そっちのロビーをしていますので、ロビーしている側の方もよく知っておりますけれども、非常にこれは政治的に大変困難な状況がアメリカでありますので、日本もどこがどれぐらい大きな力を持って声を出すのかということは政治の結果を見るとどこが力があったかがなんか見えてくるんじゃないかなという気がします。でも本当にもっと長期的な、そして市民のレベルでもっとマスの人たちが利益を得られるような、そんな長期的なシステムを作っていかなきゃいけないんだろうというふうに思います。
ぜひひるまないで進んでいただきたいと。他に会場からもし時間がちょっと限られてるんですけど、じゃあ。
Yes, Bill Bishop from Becton Dickinson. I just wanted to make one statement and then maybe hear some comments. When you were talking about the medical fees, it was interesting you left the other half off. If you look at what was done, a cut of 5,500 oku, right? So that would be gosen 500 oku yen, was cut in reimbursement prices, and gosen 500 oku yen was added in medical fees. So they basically pushed the toothpaste from this end of the tube to the other, right? Still the same toothpaste in the tube. Now, why did they push it to medical fees away from the reimbursement for the actual drug or devices is really indicative of what's happening to the system and has been happening over the past several revisions. And that is that Japan is moving to a prevention paradigm, slowly shifting to this primary care model where doctors and hospitals and clinics are reimbursed for fees, you have to earn money somehow, rather than yakasa. Because the system used to be run by the difference between the reimbursement price of drugs. We know that. And for many years now, since 2000, you've had bungyo, and you're now at about 60%, and that's the splitting of prescribing and dispensing. So what's happening is slowly but surely the incentivization to move towards a prevention paradigm is done through the payment of fees rather than through a rather less than desirable system of a difference in reimbursement prices over sales prices through the oroshi system. So, I mean, that's the reality going on here right now. I think it's a very positive reality, and it's really a good thing. You have something that's going to happen here in Japan that's being rewritten right now. It's called Kenko Nihon 21. And in 2013年ですね、あれいつ始まるかわからないんだけど、but anyway, in 2013, Kenko Nihon 21 is supposed to be rolled out. And what it is like Healthy People 21 or 2010 we had in the United States. We might have it 2020 now, where it sets a number of goals for the country across a broad range of health and wellness objectives. The point is in this, because this is still being written, and I would like to know, is there still an opportunity, because we've been talking about the lack of concrete metrics. Are metrics being set in Kenko Nihon 21? And if they are, because unless there is a metric, unless you can measure it, you can't manage it. And if there are, then this is really the earlier question, where do physicians prioritize? You know, where do they focus on priorities? Actually, Kenko Nihon 21 would be where they would focus on priorities as the system shifts to a prevention paradigm. So if anybody has comments on that, I would very much like to hear it. Thank you.
I'm not sure anyone here knows whether there are concrete objectives, so let's take the rhetorical question. It's not the first initiative. We had earlier initiatives about measuring your waistline, people were walking up the stairs using their pedometers and so on. And Japan actually is doing quite good work in that area. It works. It works at least for a while, as long as people are excited, but of course it gets worn off, and you need a new initiative. And unless you have the new initiative coming, the long-term effects of that are not there. And in that sense, you're right. Actually, what we need are clearly defined objectives. Maybe if I can comment on your earlier thing regarding Choikyo and the fee setting. This is symptomatic of the problem we have with the system. The system essentially is underfunded as it stands today. To do what everybody is doing today, doctors would need to be paid more money. Drug companies need to be paid more money. Now, there isn't enough money, so what do you do? Well, you do what's easier. You give the medical institutions a bit more money, and you take it away from the drug and device companies, because they can't do that much about it, at least to a degree. But in the long term, the system won't work like that. And that brings me back to the earlier point. Something has to happen about the inputs, the activity. Some controls are needed there. People need to incentivize by outcomes and not by input. So we get away from this high volume, low price system.
ありがとうございます。